Traditional medicine was the dominant medical system for millions of people in Africa prior to the arrival of the Europeans, who introduced evidence-based medicine, which was a noticeable turning point in the history of this tradition and culture. As colonialism spread through Africa, colonialists built general hospitals and missionaries built private ones, with the hopes of making headway against the widespread diseases. The healthcare system thereby received a major revival as people began to notice a heightened level in mortality as opposed to the traditional method. Whereas traditional medicine continued to play an important role in Nigeria up until 1990, the country made great strides in the provision of modern healthcare to its population in years since World War II, particularly in the period after independence. Among the most notable accomplishments were the expansion of medical education, the improvement of public health care, the control of many contagious diseases and disease vectors, and the provision of primary health care in many urban and rural areas. In the late 1990s, a large increase in vaccination against major childhood diseases and a significant expansion of the primary health care became the cornerstone of the government's health policies. The Federal Medical Centre was established in November 1999 with Dr. Daniel Bobsom as the first substantive medical director. Dr. Idris Balasa succeeded Dr. Bobsom as the medical director in March 2003. During his tenure, he secured the present premises from the state government where it was serving as the State General Hospital. Dr. Inusa Wiza succeeded Dr. Idris Balasa in 2011 and continued in the footsteps of his predecessors in a bid to improving on every facet of hospital services. Dr. Aisha Shehu Adamu succeeded Dr. Wiza in April 2020, a consultant physician in the Department of Internal Medicine. She currently serves as the substantive medical director and has proven the mettle of her competence through her dynamic style of administration and laudable projects experienced in the hospital within these 3 years of her stewardship.
I am Dr. Aisha Shehu Adamu, the MD of Federal Medical Centre, Jalingo. I was appointed in 2020, March, by President Muhammadu Buhari for a tenure of 4 years. I've spent 3 years so far. So when I was appointed, I came in and carried out an assessment of the hospital, paying attention to these pillars of infrastructure, personnel, equipment, operations, and then monitoring and evaluation. So I set up committees based on that, headed by seasoned administrators local to the hospital. They came up with a report and presented the report. So based on what we have on ground and what we need going forward, we've been initiating processes to meet our target. The first agenda is that of infrastructure. We came and met some structures on ground, but they were dilapidated and we needed to renovate them. And because we need to expand the hospital, we had to build new structures. The federal government, through the Capital Project Initiative, was able to fund a lot of projects for us. We have a new ICU, we have a new operating theater, new kidney center, which we didn't have before. We have an accident and emergency complex, which is almost being completed. And we also had some donation from philanthropists. The TY Foundation gave us a pathology unit, that is a mortuary, and then intervention projects from other legislators like the pathology department. So that is what we have in terms of structures. We're also pursuing the Federal Ministry of Water Resources, Ministry of Works, so that we can have Potable water. As it is, the hospital as big as it is, we have to get water using a water tanker. So we are pursuing pipe-borne water and road network. We hope very soon that will actualize based on the budgetary allocations. And also in terms of personnel, we came in and made a workforce of over 1,000. And so far we have sent a lot of them to school. We have trained and retrained many. We have employed a lot. We employed over 500. So we have beefed up the workforce of the hospital, hoping to meet the demands of service delivery. Because the population is increasing, so the need for more health workers is also increasing. In terms of equipments, the federal government's ESP program helped a lot to beef up our equipment. That is the Economic Sustainability Program. So we were equipped in terms of ICU equipments, in terms of laboratory equipments, in terms of isolation equipments. So we have a lot of them that we bought and are now in use. Through the capital project too, we've been able to buy a lot of equipments for several departments in the hospital: orthopedic, ENT, maxillofacial, dental, and so almost every department has been touched in terms of provision of equipments. And then we've also been able to set up a monitoring and evaluation system in the hospital so that we can know what we are doing, monitor people as the process is ongoing, analyze the situation, evaluate and use the information we get to improve services. As part of the capital project also, to improve communication in the hospital, we were able to set up a small mini public address system we call radio FMC that can be able to disseminate information massively to the general public. And we also brought in, hitherto we did not have intercoms network. We were able to bring it in so that it will ease communication between the various units and departments of the hospital. I think basically this is what we have done, and we're looking forward to doing more. We have our specific targets that we need to meet.
My name is Usman Abdul Rashid. I'm a medical lab scientist and the manager of the molecular lab, that is the complex we are in. The department, as you can see, is recently built. This was commissioned last year, February, and you can see that it's a new complex, and this is the first building that was constructed by the present administration, that is the administration of Dr. Aisha Shehu Adamu. And the complex house very major equipment that are required for PCR work. By PCR work, the difference between this laboratory and any other laboratory is that here we test for the cause of the illness. By that I mean, if you come to the hospital and they say go and do hepatitis test, they are just going to see the evidence of the presence of the hepatitis in your body. But when they say do molecular test for hepatitis, that means they want us to find the actual organism. So this is like the gold standard. All we do here is the gold standard in testing. If I tell you we do HIV viral load, is the gold standard. Hepatitis viral load is the gold standard. If we say it is there, it is there. It's not there, it's not there. That is what I mean. So it is her administration that come up with this complex that have arrays of equipments. We have platforms here that can do samples from 500 to more than 1,000 within one day. And We are not boasting, but this is the only laboratory in the Northeast that has such equipments. We have an equipment that is called Hologic Panther that can do about 1,500 samples per day. We also have Abbott MB2000 that can do about 300, and there is now an Alinity. That Alinity can also do 1,500 and above. So there is no laboratory in the Northeast that has that capacity. And apart from that, we also have open system. Open system means you can get your reagent from anywhere and it can run. And we have what is called the MIC, magnetic induction cycler. That one can do most of the PCR work. And also we have what is called Quantiflow that can do about 96 samples at a go. So as for capacity, here we have the capacity to do most of the molecular work that is done. So apart from all what I have said, there is also room for expansion. Behind us here, you can see a new building, courtesy of Northeast Development Commission. That place is also a virology lab, and we intend to use it for resistant testing. By resistant testing, we mean if people are taking drugs and they are failing, like in HIV, which is the best known. If people are taking drugs and they are failing, they can fail because the drug is no more working. So there is no place in the country now where such things are done except in two places, Lagos and in Abuja. So we intend to go into that. It is called drug resistant testing. So that is our plan there. And we also plan to go into research. By research, people that have postgraduate students, that is people that will do masters and PhD and even postdoctorate. If they have any work that is molecular, that means they want to do the test that will identify the cause of the organism using molecular study, they need to come here. And when they come, we run for them. Already we've started. There are some students that their work is on finding the causative agent of cancer of the cervix, that is cancer of the private part of the woman. And we run the test here for them. It is called human papilloma PCR. We ran thousands of tests here, and the woman satisfactorily left. Even way before, she has to take it outside the country, South Africa or even Gambia here. But by the grace of God and with the contribution of this administration, it is available here. And we intend to have collaboration with all the research institutes and the universities here.
Before she came in, there was no dialysis machine in the whole of this hospital. So, and thank God now we have dialysis. Patients are being dialyzed, not taken to Yola or any other place. So also we have mobile X-ray machines, so many equipments that you cannot even mention.
So many units in the hospital have gotten additional equipments, particularly in the Department of Medical Laboratory. A lot of tests that we cannot do in the hospital previously are available in this center now. Take, for example, the screening for Lassa fever. Previously, we do send patients to either Irua in Edo State or to Abuja for those investigations. The tests are available in this hospital. We can screen for COVID. We can screen for a lot of other viruses. So also immunological assays, hormonal assays, and what have you. So many equipments were made available within this in the medical laboratory. So also in the medical departments, we can be able to do something like echocardiography and some other endoscopy. We've gotten, in fact, not just ordinary endoscopy, we can do therapeutic endoscopy now. The same thing in surgical department. The unit under surgery department or some unit under surgery departments were adequately provided with necessary equipment to work with.
We've received so much equipments, both donated and those that were procured by the hospital. And these equipments have been assigned to the various units of the hospital, and they are working perfectly as we speak. And another thing is that our laboratory were actually rudimentary then, but now we have one of the standard molecular laboratory in the hospital. Kudos to our medical director. The lab that we can do, apart from the basic investigations, we can do COVID tests. We can also do Lassa tests in the hospital, apart from the basic ones.
Before now, we had in the lab, we had the department of the microbiology unit, the chemical pathology unit, and the hematology unit. But with the coming of the current administration, we have added the molecular lab of the Federal Medical Centre, Jalingo, and the department of histopathology, which, like I said, was hitherto non-existent. These two units have helped in increasing our capacity to make diagnostic, to improve on our diagnostic capacities as it regards the laboratory. The histopathology unit is responsible for making a histopathological diagnosis, which involves analyzing tissues to get to the root of disease, of diseases afflicting any particular patient. The chemical pathology, like the name connotes, deals with the chemistry of mostly body fluids, blood, urine, saliva, and the likes.
Before now, we had a lot of challenges in doing maintenance, be it structure, be it plants, be it equipment, but with our coming, we've improved remarkably. Where some equipment were abandoned, with our coming, we activated them and we are moving forward now.
On coming on board of the medical director to Federal Medical Centre as the chief executive, she came with this passionate desire to digitalize the hospital. And in the first 3 years, she has achieved this tremendously significantly in so many ways. First of all, she sought for intervention in the area of ICT infrastructure, of computer system, digital library, internet facilities, accessibility to everyone. And she was able to get support and help from Nigerian Communication Commission by supplying ICT, that's computer system, then hospital software, electronic health records management software, which it tested for 1 year, and it worked perfectly in partial implementation in some departments. At the moment, 3 years of her assumption into leadership of the hospital, ICT has significantly made mark in the whole of the hospital, whereby a patient can come to the hospital today without paper exit. The patient will see doctor seamlessly, all on computer. And this is a major achievement in the area of universal health coverage through digital health. By so doing, so many things are achieved. There will be transparency, accountability, there will be no loss of record, because all patient records in the formal practice, where you have folders and this, you may not see any folder, or a patient folder can be missed. But in this, with this software, electronic software system, there is no folder that can be missed, and no matter how long the patient comes back, the hospital history is there. This is a major achievement. Also in ICT, she has ensured that there is access to internet by making contact to NAGCOMSAT, where she deploy a sector of internet access, whereby staff can use the internet by just browsing on their phones, their systems, which is running at the moment. So these are tremendous achievements in the area of ICT. And her passionate desire is that at the end of the day, everywhere is fully digitalized. Also, the store has inventory software, which is ICT compliant. She also has brought in a software for asset register, whereby all assets are digitalized, they are on system. So there is no loss of this thing. And to achieve e-health in every system that she's doing, it will curtail a lot of leakages. It will also save cost in so many areas. So we can summarize, say that she has transformed this hospital from analog to digital practice. And we can also say she is a digital health ambassador, practically and real.
Since assumption of the present medical director, Dr. Aisha Shehu Adamu, we've seen tremendous change in the whole hospital. And what it entails is she assumed office. She now made it that about 4 pillars that she is going to work on, for example, infrastructure, operations, then personnel, and also equipments. So thank God, assessment team was formed, committees were formed, and then from there she kickstart. The committees now started the work. So after completing, reports were submitted, and she has been working tremendously on all the issues based on the assessments that were made.
The infrastructural development in the center was backward. The center is lacking a lot of structures, and because of that, a lot of activities that are supposed to be undertaken in the center were not been able to be done. Before her coming, since the inception of Federal Medical Centre Jalingo, there was no master plan for the hospital. Coming to office, that was the first thing she instituted, which I directly handle as the head of department of the physical planning department. Before her coming, we don't have this present department called physical planning department. It was works department. But because she's a leader with passion for the hospital, with passion to grow the hospital, she decided to split the works department into 2 in order to achieve efficiency in her activities. And so this department was created in March 2022 to specifically handle the infrastructural development of the center. And at this point, I will roll out some of the things and some of the achievements that have been done under this period, under review. She's up to 3 years now, or about 3 years in office. And as the head of department, since the creation of this department, I will roll out some of the things that we are able to achieve by her guidance. When the department was created, there are challenges, as I said earlier, in the infrastructural development. So she set out the space, and then we got into action. New buildings were erected between the period of 2021, 2022, and some are completed and some are ongoing. One, we have the auditorium complex. For the NEET, if FMC is conducting its promotion exams, they used to go to School of Nursing because we are lacking hall. We are lacking auditorium that will take large number of staff. So seeing this need, she swung into action, and then the construction of auditorium was initiated and is ongoing. It's at DBC level now. And then we also saw the need to have our own foil dome. Hitherto before now, we used to buy foil from the filling station and then store them in the surface tank. And that will not give proper accountability as regards to foil consumptions in the hospital. So we decided to build a foil, like a mini filling station in the hospital, and named Foil Dome. It's ongoing too. And if we have a filling station and there will be a need for a fire service unit, which is going to take care of the unforeseen circumstances as regards to fire outbreak in the center. So that building too is still ongoing, and the fire service unit is created and is still under my unit, under my department in fiscal planning department. And then we have the new accident and emergency complex. It's ongoing too, with hope that it's going to be completed and put to use by March of this year, that means 2023. And then we have our kidney complex that is still ongoing too. Hitherto before now, we don't have anything kidney. But today, due to her leadership qualities and style, a structure is put on place and is ongoing, and we hope it's going to be completed this year. And then we have the pathology complex, which is going on. And then we have the new mortuary. It's an intervention from a well-meaning individual in the state. And then we have the virology complex, which is completed, given to us by the Northeast Development Commission. And then we have the houses, donated also by the Northeast Development Commission, which is still ongoing. And then we have the neonatal complex, which is completed and is already put to use. And then a lot of first lift has also been undertaken to give the hospital a good presentation. So some of the old structure has been upgraded and some have been renovated. Public Health Department, if you are coming at the gate by the left, you see it there. We have the wards that are going to Ward 1, Ward 2, Ward 3, Ward 4. All of them have been upgraded. And then we have building like the Finance Department. It has been upgraded and given first lift. We have our house officers' quarters. That too is completed. It has been given first lift. Now the NHIS is ongoing. And our eye clinic, our social service, welfare services department, our consultant block are all in the pipeline to be upgraded and be given first lift. And there are other programs that are in the pipeline that pleases God. We are hoping and praying that this administration will be able to actualize them.
There has been a marked change in the hospital since she came on board. When she came on board, the hospital to a stage was more like a dilapidated place. Her coming on board, she uplifted the hospital even before the new structures. In my own department as nursing services, all the units enjoyed renovations. After the renovations, the wards have been barricaded. I mean, they've been barricaded because it's no longer the market that used to be that somebody can just go in. And patients will tell you that they feel at home now than before. In the area of nursing services as well, we have enjoyed, we have new structures on ground. Before she came on board, we had no intensive care unit. Of course, all the critical patients, we transfer them to Jos, to Gombe, to Abuja, and sometimes, most times, we have to use flight. To the glory of God, today, our critical care unit is one of the best in the whole country, with less mortality. Part of achievement that we've have been part of this department is the construction of the modern accident and emergency unit. Of course, our accident and emergency unit currently is an ISO, and by the grace of God, very soon we are moving into that complex, and all those challenges we've been having in the past, we no longer have them. Of course, we are equally one of the centers that we have very good isolation unit, because we have up to 2 isolation units where we manage infectious diseases in the hospital.
We are looking at building a nutrition and dietetics complex. That one would take care of our general kitchen for the clinical staff and non-clinical staff, and then it will take care of a medical diet for our patients that are going to be on a special diet. So the nutrition and dietetics, if we achieve this, that is what it seeks to accomplish. And then we also seek to extend our present amenity. Though we found out that there are VIPs that patronize amenity, and as it is now, the capacity is inadequate. So we intend to extend our amenity so that we can accommodate other activities that hitherto we are not been able to carry out. Then we're even thinking of also upgrading our pharmacy complex. If it is possible, build a new befitting pharmacy complex for the center, and then the pediatrics complex. All these are in the pipeline to actualize them. And then we are thinking of also upgrading our laboratories to make it have a befitting structure, like a story building that will accommodate. As if you look at it now, our laboratory, they are being scattered, so we are looking at having a complex that will take care of all the various units in our laboratory. And then it is under her regime also. I must stress this. Before now, previous administration has been trying to see that we have residency in O&G, but they are not able to pull it through. But with her coming in office, within a year, she has pulled through this. So now we've been given accreditation to train O&G consultant, and so because of that, we have an outstation. We call it Comprehensive Health Center Apawa. So there's a outstation here that is up and running, and there we also intend to do a lot of infrastructure there. We intend to increase the walls that are there, to fence the quarters, to build the administrative block, and to renovate the dilapidated buildings that are there. And there is a partnership that the hospital is running also with the Taraba State University. One of the challenges that we have here is land. As you can see, with our coming, we've developed all the available spaces we have. So we are reaching out to look for land. So luckily we have a land here, NTA land, behind us here, which we are trying to acquire by the special grace of God to expand the hospital. And we are also, in the pipeline also to try to acquire some of these shanty houses that are at the fence of the hospital, so that we can expand the hospital to be able to carry other structures that we intend to put in place.
So in terms of personnel, staff as department. We, the head of departments, have been battling with the issue of lack of staff. But since her assumption, she has taken it upon herself that she is going to follow the due process in making sure that staff are employed. Thank God, staff processes were followed from beginning to the end, and waivers given to the management to employ, and employments were made. So many staff now came in based on the approvals given to us, and as such, the departments, you can see now we are a bit comfortable. So also, these staff are not only employed and then left like that. The staff who are employed, they are trained in-house trainings. We are done to all of them, even the old staff, trainings and retraining, series of trainings, both internally and also internally, I mean within the hospital, that resource persons are brought in to do the trainings, and also for those that are being sponsored to go elsewhere, maybe Abuja, Lagos, or other states. So the staff have benefited so much from it. We really appreciate the efforts of the management. If you look at all our offices are well furnished. Without the offices, staff will not have conducive atmosphere to operate very well.
When she came on board, our total staff strength was 218. We had a staff strength of trained staff were 218. But as I tell you right now, we have over 400 trained staff in this department alone. Before she came on board, training was something difficult, but training and retraining has been very good. And from 2020 to this 2023, we have enjoyed the training of not less than 20 undergraduate approval per year in the department, and various post-basic training in area of specialties. The number have also increased tremendously.
She have recruited a quite number of staff in the key clinical areas, and during her period also, she have tried to see that we have got accreditation for the training of residency in O&G. Especially during the 2021-2022, a lot of staff who were stagnated were promoted. I think those who attended, over 70 to 80% have passed their promotion exams. Most of the staffs are happy, and they have acquired new skills with the training. And those who have gone for workshop have come back to step down the training to the staffs.
First of all, my name is Abdulwahab Kabiru Sani. I applied for this job the way people used to apply it, and I got the job without any bribe. I didn't pay any money or ransom for anybody to get this job. I got this job without paying anybody. I'm happy because this is the happiest moment of my life. Let me just say that, because this is the first biggest appointment that I've gotten in my life. Staff were very friendly during documentation. The environment was conducive.
My name is Ayog Juliet Choma. I'm from Enugu State, a student of Science Laboratory Technology, Enugu State. Recently, I did my IT last 2 years here in Federal Medical Centre, Jalingo. A friend of mine called me that I should come and apply for a job last year. So I was like saying to her, I'm not a Tarabian, so it's likely that they won't take me for a job here. But for the other hand, I just said, okay, let me just apply for applying sake. So I wrote my application letter last year, ending of January. I submitted it. So I've already even forgotten about it. I've already traveled back to my state, Enugu. Shockingly to me and luckily, they called me last week Thursday. Are you Chioma on phone? I said, yes, ma. I said, rush to FMC and come and collect your app. I said, how, ma? He said, I should just come. So I was like so surprised, because I was like, I'm not from Taraba, and this place is just like a hot cake for you to get a job here. I was like hearing that you do this or do that, but for me to get it in a platter of gold, just like that, I'm very, very shocked. So all my thanks to the MD, the Medical Director Center of Jalingo. I just want to say very thank you for giving us a job opportunity without sentimental or saying this she's from the east or she's from this and she's not a Tarabian, but she gave it to us from a different location of the state. So ma, we just want to say thank you.
As a proactive medical director, she has been able to obtain approval from all the necessary government agencies for the recruitment of certain number of staff. As I speak, the needed staff have all been employed, the biometric completed, and they are currently working. In addition, within this period of 3 good years, it is not just the current employment she's been able to achieve. This happens to be, I'm referring to the employment of 2022, completed in January 2023. It's the second set of it within a period of 3 years. Going by that, you can now imagine the amount of money that this woman has been able to bring into Taraba State and how this is going to affect the lives of many that depends on the staff employed. In terms of staff welfare, the promotion that is supposed to be done, it's already done as at when due. So also, staff-wise, you are allowed to work without intimidation. You are allowed to work freely, suggest where necessary, and what else do you need as a staff?
Have the privilege to head the Servicom unit, which directly works with the Office of the Medical Director. Servicom, as the name implies, is just service compact with Nigerians. So what my unit actually champions is to ensure that every customer, and by customer I mean patient, their relatives, or anybody that has 1 or 2 businesses to do with FMC, the moment you come into FMC, it's our duty to ensure that you get service that you so rightly deserve, and you get service commensurate with whatever money or amount you are paying to FMC. And to also make sure that you are treated with utmost care in a very humane and dignified way. Our goal is to make sure that you leave FMC after the business of the day feeling happy and wanting to come back again to do business with us the next time. So this is what we hope to achieve, and we've been working hard. I would quickly like to say that Servicom didn't start with me coming on board. Before I came on board, there has been Servicom in this hospital. But this administration has given some new energy and improved the way we do Servicom business here. When I came on board, Servicom principally does not have office. Servicom officers operate from the corridors. But as we speak, an office has been assigned to us, and as I also speak, work is ongoing to modernize and furnish the office so that work can launch out from a very conducive environment. So to me, this is a giant stride. It's never been there before, and it's something we are beginning to have. And I also like to quickly say that the coming on board of this administration has actually helped us with all the relevant materials we need to be able to push the staff to understand the need to give service, understanding the patient's Bill of Rights, which has given the patient some privileged positions and has given the patient the legal standing to demand for certain rights, and also the understanding that the staff has as a responsibility to give those services the right way. So this administration has actually helped Servicom to be able to achieve on this fundamental mandate, and I think is something we in Servicom are happy about. I know that there is still work to be done, and I'm hopeful that going forward, before this administration comes to a close, Servicom will be in its best position to be able to give service to whoever comes to do business with FMC. We've done a lot of training, workshop, and sensitization to the hospital community, and that has done us well in terms of quantifying and assessing how much improvement we've made in the lives of staff in terms of their capacity and to deliver service the way they should deliver as government has so stipulated. So these are very, very good things that is worthy of mentioning.
The Anti-Corruption and Transparency Unit, Act 2, is a unit that has been established since 2001 by the Independent Corrupt Practices and Other Related Offences, that is ICPC, in all ministries, departments and agencies. The aim of establishing the unit is for ICPC to implement, is just like an implementary mechanism for ICPC for its mandates on the prohibiting and preventing corruption in the public sector. ICPC has established the unit, and the unit drive its mandates from Section 7, Subsection 1 and Section 70 of the ICPC Act, and the unit is charged with the responsibility of making preliminary investigations in the institution where evidences shows that a staff has conspired or is attempting to commit offense that contravene the ICPC Act or any of the laws that prohibit corruption. And therefore, the Act 2 is mandated to do a preliminary investigations and forward the results of the investigations to the Managing Director and then to ICPC accordingly. Act 2 also is charged with the responsibility of public enlightenment. One of the ways of preventing corruption is to do a public enlightenment to your staff. We have been actively involved in staff orientation. We teach them about corruptions, prevention. We teach them about professionalism and so many other things. Currently, we are doing orientation lectures for the newly employed staff as mandated by the management. We have the privilege in Act 2 to be working actively in this regime, being that the medical director, who is the pioneer chairman of the unit, she has been the first Act 2 chairman of Federal Medical Centre. I believe she understands what Act 2 means and what is the importance of Act 2. On that note, since the inception of this regime, Act 2 in Federal Medical Centre has been excellent, different from any other Act 2s. I'll give you examples of that. Because of the medical directors striving so hard to make sure that all the needs of the unit has been met, the staffs within the Act 2 unit has been trained in various capacities. We have gone for so many training in the Anti-Corruption Academy. We have done so many training on site. Just like 2 months ago, I was even privileged to be at the ICPC headquarters in Yola on behalf of the institution, where we made presentations, and based on the way our capacities were developed, I want to tell you that Act 2 Federal Medical Center Jalingo came the best. And we were recognized by the zonal office in Yola to be the most active ACTU so far. And we have participated in deploying the ICPC scorecard for the establishment, and which the result came out, still ACTU FMC Jalingo came out to be the best of all ACTUs in the nation. And you see all those achievements are coming because the medical director has given so much effort to see that the unit is functioning actively. All these trainings we do to staffs and all other things entails the support of the medical director. As stipulated in the standing order of the ACTU, it is mandated that this unit is supposed to operate like an autonomous body, but with a functional linkage to the office of the medical director. Therefore, the budget of the office is directly under the medical director's office, and the medical director, being a pioneer chairman, has been living up to expectation. And ACTU presently in FMC has been wonderful. Thank you.
You know, we deal with patients who have HIV. So since the inception, we have about 3,000 patients who are currently on treatment for HIV. Before the coming of the new medical director, we used to have clinics 3 times in a week: Mondays, Wednesdays, and Thursdays. But now we have it every day, from Mondays to Friday. We see these patients every day. We give them their drugs free of charge and other investigations they do. Okay. We also have implementing partners. That is, we have the major one of them is called RISE. They are under USAID. So they support us with the drugs, laboratory reagents, and they also update our staff in terms of training and retraining of these staff.
We are hoping that we will step up, not just engaging the hospital community, but we'll also be engaging the general public using media outfits like you and other media outfits out there, so that people can understand that when they come in here, this is a civil place. They need to behave in a civilized manner so that the workers can also have the right atmosphere to give them the quality service they so desire. Our gold standard is to make sure that everybody that comes to FMC goes back home with his problem solved. Thank you.
Appointments in the Federal Medical Centre, Jalingo. As from 2020 to 2022, there have been a whopping number of appointments. 186 staff have been absorbed into the workforce of the center to enhance efficiency in service and healthcare delivery. There have been a variety of trainings facilitated by the Training and Staff Development Unit in 2022. A few amongst these capacity building sessions: sensitization of infectious diseases. Participants, all staff of the Federal Medical Centre, Jalingo. Date, 8th of February 2022 to 28th of March 2022. Interpersonal skills for performance improvement by NIM. Participants, MD, HCS, DHCS, DA, and 44 other selected staff. Date, 2nd June 2022 to 4th June 2022. Medication and Patient Safety by FMC Jalingo in collaboration with WHO, World Health Organization. Participants, all staff. Date, 17th September 2022. Moving and Handling of Patients by Dam El Joe, Nigeria Limited. Participants, all selected staff. which constitute of 11 nurses, 2 surgeons, 1 physiotherapist, and 5 doctors. Step-down training on QMS. Participants, all unit heads. Date, 26 September 2022 to 28 September 2022. Workshop on medical legal aspect of healthcare practice. Participants, 3 persons from all clinical department and legal unit. Public Service Rule, Human Resource and Staff Development Unit. Participants, all HODs. These are but a few amongst the numerous capacity building sessions organized. The FMC Jalingo HIV and AIDS program reports. The program started 2005 to 2007 with the government of Nigeria. Then the Family Health International and Global HIV/AIDS Initiative of Nigeria took over from 2007 to 2012 March. April 2015 was National Agency of Control of AIDS and SURE-P and lasted till March 2016. The Nigerian government took over the project from April 2016 to September 2021 as NACA Comprehensive AIDS Program with 2 pilot states, Taraba and Abia. Early infant diagnosis EID laboratory was commissioned in the center. May 12, 2009, the center was to serve the northeast of Nigeria. October 2021, Japaigo came with the RISE project. Other implementing parties include Society for Family Health, Lafian Yara Project, Elizabeth Glaser Pediatric AIDS Foundation, ProHealth, ICHSSA4, Japaigo RISE Project. Trained personnel, 7 doctors, 3 pharmacists, and 10 nurses were trained, while 4 laboratory scientists, 4 medical records, and 5 medical social welfare were also trained. Japaigo equally added 14 trained ad hoc staff. The U.S. charged affair was in the facility in August 22, 2021 for a 1-day working visit.
Before the coming of the present MD, we've been running this program by different organizations in the facility. But when she came on board, a new organization also came on board to also take over from other NGOs that have been working with us in the facility. Before the coming of the RISE project, our data, as in data side, because the M&E coordinates the data for the program, our data have been collected manually, and we've been doing that on a monthly basis. But with the coming of RISE as a project, we have what we call the high frequency reporting, which is being done daily. We report our activities on a daily basis into the database, high frequency reporting database, which the organization at their own level also see what is being reported from the facility level. So at every point in time, they get to see what was being done in the facility by going to the dashboard for that facility. Before, it wasn't done like this, but we have the computer that capture those data, but it cannot be accessed directly at their own end, that is at any point in time. But this time we have what we call the real-time data entry that can be accessed even from Abuja, the headquarters. It can be accessed. So the report is being collated, as I said, daily, and collated on a monthly basis. So presented for the facility. So far, so good. With the coming of RISE, a lot of things have been put in place to ensure our clients don't default in their medication. So one of them is task shifting. The facility designed that to ensure that they don't miss their appointments. They must not necessarily see a doctor all our stable clients goes to the pharmacist to pick up their drugs, except for those that need to see the doctor that does that. And to also ensure they take these drugs, the project employed case manager that does that this drug is being taken to another level, to the doorstep of these clients, that they intend to pick up to ensure they don't miss their appointment. And by so doing, in fact, there has been a huge turnaround, a huge turnover. They haven't been missed appointment and lost to follow up, unlike before. So the lost to follow up have been maintained, curtailed, to ensure that the number of clients we say we have